Now, today we're going to talk about hepatitis C. As she rightly said, it's one of the causes of hepatitis. Hepatitis C, if you to remember, leads to chronicity. Okay, so when somebody, how do you acquire hepatitis C? Also through blood and blood products. The common mode of acquisition of hepatitis C is through IV drug use. When people share needles, when people share sharps. As we said in our previous episodes, if I share a needle, I jab myself with a needle, and you use the same needle, it can transmit the infection. It can also be acquired through blood transfusion. It can also be acquired through piercing, tattooings, if all these instruments are not well sterilized. Now, usually most patients with hepatitis C may not have any symptoms at all. And the only way to pick them up may be routine screening. A few of them may also present with complications of the disease, and that is what alerts the caregiver to actually go and do the test. Now, the interesting thing with hepatitis C is that apart from affecting the liver, it can also affect other parts of the body. It can have an influence or an effect on the kidneys as well, and even on the skin and other places. So, how do you know if somebody has hepatitis C? What we usually will do is to first screen with the hepatitis C test, the antibody test. Once it's positive, it tells us that this person has been exposed to the virus. But we are not sure whether the infection is still ongoing or past infection. And the only way to know if somebody with hepatitis C antibody positive still has the infection is to actually look for the virus in the blood. So we do what we call the hepatitis C viral load, or RNA. Now, when we see that the virus is present in the blood, then you need to be worked up for treatment. So we'll do your liver function test. We'll look at the level of inflammation. So we can do what we call the fibroscan test, or we can do a biopsy, take a piece of the liver, as we said previously, and then look at it under the microscope to see if there are any cells that tells us that there's damage within the liver. We also screen for complications, so we do the ultrasound scan, looking at the size of the liver and then the architecture of the liver as well. We do the alpha-fetoprotein, and as I said previously, if the alpha-fetoprotein levels are very high, it's an indication of a possible liver cancer. Then we also have to check if we find, because hepatitis C and B are very closely related in terms of how it's acquired, and as well as HIV, the mode of acquisition of these three viruses are the same. So when we find one, we look for the others as well. Now, how do we treat hepatitis C? Treatment of hepatitis C has gone through and now has been very, very successful. Initially, we were giving injections, and then people, about 50 to 70% of patients were responding. But currently, we have what we call the direct-acting antiviral. And this is just tablets that we take for 3 months, and then we get about 95 to 99% cure rate. Hepatitis C, as I said, meaning that it can lead to chronicity, and now interestingly, we can say hepatitis C can be cured. Now, if somebody has hepatitis C, we give this direct-acting antivirals for 3 months, and then hopefully it clears the virus from the system. However, we continue to monitor 6 months to be sure that it's really, really cleared, and then a year after treatment. Once that is done, we say we are cocksure that the patient has been cured.